diagnosis. Let's read this scenario. A 39-year-old female. So the age is still a little too early for the development of a senile cataract. Female visited to our clinic for ophthalmic routine examination. Routine examination. No underlying disease. Complained of slight muscle and general weakness. Okay. Underlying disease means that it doesn't have diabetes, she doesn't have hypertension, but she complains of slight muscle and general weakness. So this is a big clue. And her brother had died of myotonic dystrophy several years earlier. This is another big clue. She had mild bilateral ptosis on examination. Another clue. On examination, this was noted. So let's rewind a little bit. Examinations is थोड़ा पीछे आते हैं. 39-year-old female presents with symptoms. As such, she doesn't have general symptoms. इतने complaint नहीं इंक्लूड है, but except disregarding the ophthalmic symptoms, क्योंकि इसमें नहीं लिखे हुए, other important symptoms. What are those? She has slight muscle and general weakness, and her brother had died of myotonic dystrophy. Now this is a big clue. Okay, several years earlier. Now on examination, she also has mild bilateral ptosis. So from this, we can deduce that she is also suffering from the same disease. So her diagnosis is most likely myotonic dystrophy as well. मैं आपसे पहले आपको खुद बता रहा हूँ. So in cases or scenarios, if there's a relative given or there's a family history of a disease, we have to consider that disease in the same patient as well. Look for the signs and symptoms. So she has slight muscle and general weakness. She also has bilateral ptosis. They also point that she is developing somewhat the same disease. So hint है. We cannot be sure. आगे उसके अपनी further testing करनी पड़ेगी. But there's something which also furthers our diagnosis. And in this case, it is the presence of this opacity. So we've discussed so many buzzwords, and there's this one last buzzword left. What do you think this cataract resembles? Look at how it's colorful. It's green, and it looks like there's small bulbs or lamps or small lights of different colors: yellow, red, blue, purple, green, hanging from everywhere. So what I've just described now is it is क्या लग रहा है? कौन सी association रह गई है? What does this look like? It looks like a tree which has different colored bulbs, lights, lamps hanging from it.
Christmas tree.
It's a Christmas tree appearance. I don't know why this is named so, because मुझे Christmas trees नजर नहीं आ रही इसके अंदर. This association with buzzwords is very confusing. And that's why in medicine, whenever diseases are known, उनकी pathologies हमें अच्छी तरह पता लग जाए, and we know the definitive process, the buzzwords are eliminated as such. This is a Christmas tree cataract, which has an association with myotonic dystrophy. Remember this buzzword: myotonic dystrophy, Christmas tree cataract. आ जाता होता है. And this is how a Christmas tree cataract usually looks on examination. So let's rewind. We have seen some cataracts which have an association with other systemic diseases as well. We know हमने diagnosis देखते we saw the associations. This was a phacomorphic glaucoma, most likely नहीं phacomorphic ये था. This was a phacomorphic glaucoma. The definitive treatment in this case was the phacomulsification. So similarly, in our first case, pathologic process was nuclear sclerosis. What would have been the definitive treatment in this case? क्या थी definitive treatment इस case में? Phacomulsification. Phacomulsification is the definitive treatment in this case. This cataract, rosette-shaped cataract, traumatic cataract, is causing significant visual impairment. What will be the definitive treatment in this case?
Phaco.
Phaco. If this snowflake appearance cataract in a patient, 40-year-old patient who has uncontrolled diabetes mellitus, if this is visually significant, what is the treatment? Again, phacoemulsification. In this patient of Wilson's disease or Charcot's who has Kaiser-Fleischer rings and has a sunflower cataract, what is the definitive treatment? Visually, if it's visually, it is causing significant visual impairment, the diagnosis is, the treatment is phacoemulsification. Similarly, viscous mystery, if it's causing significant visual impairment, the definitive treatment is phacoemulsification. So phacoemulsification is a definitive treatment for a lot of diseases. Okay. One important thing is that look at the age of these patients. First thing is that they have cataracts. The second is that they are not children. बच्चा इनमें से कोई भी नहीं है. This is important in the treatment. Why is this point important? The first thing that a phacoemulsification is treatment of a cataract, and the second that these are not children. ये हमें पता लगेगा अगले केस में. So in the next case we have child. मैं scenario जल्दी से पढ़ लेता हूँ. It's a 2-year-old child brought to you by his parents because we've noticed that their child has a cat-like left eye. Left eye here. Yes, lacrimal puncta यहाँ पे नहीं है, यहाँ पर ही होगा तो नहीं, it's a right eye. It's a right eye. Exam is given below, but before we check out that, examine this eye. Cat-like left eye. This is a layman term for what? This is a layman term for leukocoria. Leukocoria or white pupillary reflex. What are the differentials for leukocoria? Differentials मुझे बताएं 5.
Retinoblastoma.
Oh, yes, leukocoria, retinoblastoma. और क्या आपके ज़हन में आता है? What else?
Congenital cataract.
Cataract, congenital cataract. That is good. What else?
Retrolental fibroplasia.
Retrolental fibroplasia, which is the final stage or बिल्कुल ही जवान की तबाही हो जाए of retinopathy of prematurity. So 3, 2 more.
Toxocariosis.
Toxocariosis. Toxocariosis or other diseases which present with a mass in the vitreous or a mass in the retina. We conveniently term those as pseudotumors. All right, pseudotumors such as toxocariosis. Last is, which is somewhat high yield, but the name is important, primary hyperplastic vitreous. Persistent primary hyperplastic vitreous. So keep those differentials in mind whenever you have a cat-like left eye. So let's look at this cataract. This is a cataract. Because on examination, we can see that there's an opacity in the lens. What is peculiar about this cataract? मुझे बिल्कुल भी आवाज़ नहीं, आपकी आवाज़ कट गई थी. So the major finding, it's actually more clearer on the left side, not on the right side. The right side, which is straightly lined here, it's not falling, it's not illuminating the right side, but the right side, my right side, or the medial side of this patient. So let me elaborate it for you. There's an opacity over here, which has a margin, and there are opacities which are going towards the periphery from this. So we have a patient who has a congenital cataract, and this congenital cataract, it has a central opacity, or somewhat a central opacity, with linear spokes radiating out from it. And this is a very peculiar description. This is a very specific description. And this is the description of a कौन सा cataract लग रहा है आपको ये? There's a name. This is a zonular cataract. Okay? Because zonules are radiating from the center. So whenever you have a patient of who has a congenital cataract, there are two important congenital cataracts for us. I'm going to doodle again to show you, give you a hint, and two important facts which you have to remember about these cataracts. So I draw here. All right, let's do this. So our patient, we have a patient who has a congenital cataract. There are two important cataract morphologies which we need to remember, and which. So the first is that is if this is the lens, our patient presents to us with an opacity which has a central, there's a central opacity or a somewhat central opacity, and there are spokes radiating outwards from it. Okay? There can be a central opacity, or if that central opacity is not present, what can happen is that there is a circle, there's a circular opacity or a semicircular opacity from which spokes are radiating outwards. There can also be another added ring of opacities around this. So this cataract, in which there's an opacity, central opacity with a concentric ring around it, and zonules radiate or spokes radiating from this central opacity, this is called a zonular cataract. And if I haven't drawn it that well, but if you can appreciate it, it looks like the wheel on a captain's wheel on a ship. Pirate ships or the old ships, उनके ऊपर captain's wheel नहीं होता था, which was used to turn the ship around. It sort of looks something like that. So this is one important congenital cataract which we have to remember: the zonular cataract. Zonules radiating from the central opacities and another concentral ring of opacities. The other cataract is simpler, and I'm going to use blue to draw it. It appears as small blue dots all over the lens. Which may be or which may not be visually, which may or may not cause significant visual impairment. So what is the name of this cataract?
Blue dot.
Blue dot cataract, right? This is a blue dot cataract. So two important cataracts which you have to remember. There's also a third. चलो मैं भी आपको बता देता हूँ because we've done this so far. Third cataract is somewhat different from these two. In the third cataract, what happens is that there are club-shaped opacities. They're not present in the center, but they are present at the peripheries. Somewhat like this. What is the name of this cataract? या आप खुद ही देख के मुझे बताएं थोड़ी देर. I forget. It's उसका मैं नाम गलत बता दूंगा तो मसला बनेगा. So इसका भी देख लेते हैं. There are two important points which are important regarding this zonular cataract and regarding this blue dot cataract. The first is that a blue dot cataract is the most it's very common as in terms of congenital cataracts as common as that. This is the most common congenital cataract. Zonular cataract is the most common cataract causing visual impairment. So there's a difference between these two terms. That a patient can have a blue dot cataract and they may not have visual impairment, even though blue dot cataract is more prevalent or more common. It has a greater occurrence. So blue dot cataract is the most common cataract, most common congenital cataract, whereas the zonular cataract is the most common congenital cataract which causes visual impairment. Yeah, so these are two important facts which you have to remember. Now, how will you treat this patient? If it's causing significant visual impairment, how will you treat this patient? जो लोग वार्ड में आए थे, those who have attended ward, उनको पता है कि how this is treated. We discussed this with Sir Rizwan. उनके ऑफिस में खड़े होके cataract पहले दिन discuss किया. Aspiration. Lens aspiration, right? So there's a little bit concept behind this. क्या है? Phacoemulsification आपने देखी है. So the process of phacoemulsification is named such because we use high frequency vibrations to break up the nuclear matter, nucleus and the cortex and all that hardened stuff. Okay, because the pathogenesis is that there's either sclerosis or hardening of all that. Nuclear sclerosis भी हो जाता है cortical cataract में जब वो progress करता है. So we need to break that up, and we use to break it up when we use phacoemulsification to break it up. After we've broken it up, we aspire the nuclear contents and then we insert an intraocular lens. अब बच्चों में ये होता है, in children, the lens is very soft, meaning that phacoemulsification की ज़रूरत हमें नहीं पड़ती. Phacoemulsification specifically meaning that we do not need to break up the lens cortical matter. We do not need to break up the nucleus because the nucleus is still soft in adults. Still soft in children. So if we do not need to break up the nucleus or the cortical matter, we can simply insert a probe, a cannula. We can simply insert a cannula into this eye and aspirate the contents of the lens. This is called lens aspiration, and lens aspiration is done in children. Yeah, this is very important क्योंकि मैं जान के भी ये चीजें गलत कर जाता हूँ. RX treatment is lens aspiration. This means that the context of the lens is a lens, cortex and the nucleus. It is aspirated without phacoemulsification, without needing to chop nucleus, without needing to chop or cut up the cortex, because they are soft in children. जो काम phacoemulsification कहती है adults में, we do not need to do that. So we can simply aspirate all the contents. So in a child who has a visually significant cataract, we need to perform a lens aspiration. What will happen if a timely lens aspiration is not done? क्या मसला हो सकता है?
Amblyopia हो जाएगा बच्चे को.
Amblyopia, squint हो जाएगा. What is the pathogenesis behind this? क्या गड़बड़ हो सकती है?
क्योंकि इसको एक आंख से नजर नहीं आएगा सही से, तो वो यूज नहीं होगी.
बिल्कुल, that is the reason, and that is why if the child has significant visual impairment, surgery is immediately indicated. Usually ये होता है कि cataract surgeries are not performed in children if they are able to see, if they have good central vision. But if a child does not have a central vision, good central vision, ये होगा कि there will be no stimulus from that eye, there will be underdevelopment in the brain, there will be a loss of vision without any organic cause, which means there will be amblyopia. And we know that amblyopia, once develops, it can lead to squint. Squint bhi ho sakti hai. So to prevent all of those complications, this child must be operated as soon as possible. So his lens must be aspirated. Lens aspiration, remember, it is a treatment which is done in younger children and in congenital cataracts. हमने बाकी सारे cataracts में phacoemulsification की because in adults, even if it's a cortical cataract, the nucleus is hard. It cannot be simply aspirated. Whereas in children, the nucleus is liquid, so it can be simply aspirated without the need to perform a phacoemulsification. Yeah. So congenital cataracts, two which you have to remember, and for MCQ point of view, the first is that the treatment is lens aspiration. The second is the most common cataract causing visual impairment is a zonular cataract, which has spokes in a wheel, like in spokes. Even though it does not need to be completely circular, but it's a opacity and the spokes radiating out from it. In a child, it's a zonular cataract. So the last case for today. With this, we'll broadly finish with cataracts. बाकी concept वाली थोड़ी बहुत बातें रह जाएंगी, which we will discuss time to time. This is our case. जल्दी से देख लेते हैं. A teenager is brought to us by his parents for poor vision for the last couple of years. काफी ऐसे से मसला चल रहा है. ठीक है. There's no definitive symptom given. There's no definitive मतलब कि buzzword symptom कोई नहीं है. Photophobia जिस तरह होता है कि हमें दो चीज़ों का पता लग जाता है, और if there's lacrimation, formation sensation, none of it's given. But an important clue is that they were counseled at his birth about a certain genetic defect. So let's meet our patient. This is our patient. Anyone have a diagnosis in mind, or should I tell you a little bit more about
Marfan
it?
syndrome.
What is Marfan syndrome? क्या होता है
Collagen
Marfan syndrome?
factor.
Collagen disorder.
Collagen disorder caused by the of enzyme, deficiency of collagen protein fibrillin 1. So pathogenesis को छोड़ते हैं. The presentation of Marfan is typically like this. Patient is long, he has long arms, he has joint laxity, and he has bone disorders as evidence in this patient. He has scoliosis. His back is not straight. So our patient is suffering from Marfan's syndrome, a disease, or whatever. He's suffering from Marfan's. So when we perform an ocular examination of this patient, this is what we see. Marfan syndrome में what is the ocular manifestation which is associated with Marfan syndrome?
Ectopia lentis.
Ectopia lentis. Ectopia lentis. So this is ectopia lentis. Okay. This patient is suffering from Marfan's and he has ectopia lentis. Ectopia lentis क्या होगा कि the patient, this is the lens of the patient, and the lens is either dislocated, completely dislocated, or subluxed, or partially dislocated somewhere. So in this case, lens gets subluxated or dislocated or subluxated inferiorly. It can be upwards and outwards. It can be upwards and inwards. It can be anywhere. Usually, most commonly, it's upwards and outwards, but it can, in this case, it is dislocated inferiorly. So you will find a crescent inside the pupillary area. कि ये थोड़ा सा उसकी तरह का लग रहा है जो हमने hypermature cataract देखा था, but there is no opacity. Because, and similarly, we can see or appreciate the fundal glow in the back. Normal red reflex है इसके अंदर भी और यहाँ भी. So this patient has a subluxated or dislocated lens, constituting a diagnosis of ectopia lentis. So what is the treatment of ectopia lentis?
Lensectomy.
Lensectomy. What is lensectomy?
Removal of the lens.
Removal of the lens. So what actually happens in ectopia lentis? You know that it's a disorder involving the collagen fibers. Lens is held in its place by zonules, the ciliary ligaments, which have collagen as an important constituent. They are weak and they cannot perform their function properly due to any reason, either due to trauma की वजह से भी आंख में झटका लग सकता है अचानक, or any other cause. The lens can be subluxated. Now, in this patient, there's no corneal opacity. Not corneal opacity. There's no lens opacity, meaning that there's no cataract. And if there's cataract isn't present, we do not need to perform a phacoemulsification, an ICC, a 6, or any of the sort. What we need to do is remove this lens and try to have another sort of ocular rehabilitation. We can insert an IOL. It can be inserted somewhere other than the capsular bag or whatever, but we need to remove that lens. And that is done by a process called lensectomy. And lensectomy is the treatment in patients of ectopia lentis. Remember these treatments, that if there is an opacity inside the lens, our treatment will be phacoemulsification. सब में ही phacoemulsification कहते हैं, बाकी काम जो है वो नहीं कहते अभी. ICC it's not done. Small incision cataract surgery, कुछ cases complication that's above our level. अगर आप पढ़ना चाहते हैं written in the books कि वो कब हो जाती है की जाती है. In general, all of the cataracts, the lenticular opacities, they are treated by phacoemulsification, except in children, because in children the lens matter, the nucleus and the cortex, they can be easily aspirated via cannula. So we do not need to perform a phacoemulsification. We do not need to give vibrations, ultrasonic vibrations, which break up that material because it's already liquid. It can be simply aspirated. Hence, a lens aspiration is done in children. Whereas in ectopia lentis, Marfan syndrome or dislocation of the lens due to trauma, any cause, we need to remove that lens. That is called lensectomy. Okay. So with this, we're finished with cataract and lens. Lens में things which are important for you are, you need to know the stages of the cataract, lamellar, incipient, immature की 3 types हैं ये, मैं correct कर देता हूँ. Lamellar, incipient, and intumescent. How will you differentiate a mature cataract from an immature cataract? What is a Morgagnian or a hypermature cataract? What is a nuclear cataract? You need to know these things. You know the pathology behind them, you will be easily able to work out why they happen. Then you need to know the important prerequisites for cataract surgery for phacoemulsification. These two. You need to know this formula. आपको ये याद होना चाहिए. This is very important because this will be asked. अगर आपसे वाइवा में नहीं पूछते, but if you write it down in the SEQs, this will help you a lot. मुफ्त के नंबर है. This one simple formula. And then complications. Complications, it's important in MCQs related. कि आपको हर किसी की 3 या 4 complications आने चाहिए. But endophthalmitis and PCO, they are in themselves both MCQs and SEQs. So you need to know the treatment of endophthalmitis, which we've discussed when we discussed uveitis. in the treatment of posterior capsular ossification, which is yak capsulotomy. You need to know these. This was the senile cataract, which we discussed. Then there are secondary cataracts, which are associated with systemic diseases. And they have buzzwords. Remember those buzzwords. Z-shaped, snowflake appearance, sunflower appearance, Christmas tree. These are some associated with systemic diseases. आपको सिर्फ associations याद रखनी है. If you name or a simple manifestation कि myotonic dystrophy में क्या होता है, Wilson's में, Charcosis में क्या मिलेगा हमें. These are what you need to know. इसमें आती इतनी detail, it's not essential. Only this is required. Then we have congenital cataracts. So the first thing you need to know is remember the treatment, lens aspiration. Then these two facts, they're tested on MCQs. Then the last is another condition, is extropia lentis. It's also tested in MCQs. They will describe to you a patient who presents with abnormally large arms, normally large height, chest deformity, rib deformity, or back deformity. He has easily dislocated joints, and he will present to you with this. So the answer is ectopia lentis, and the treatment is lensectomy. Okay, there are many important points, some important or minor points which are important. I'll try to make an MCQ a list for them, and we'll clarify it. So this concludes the topic of cataract, and next time we will start with glaucoma, inshallah. So we also have that test or that MCQ assignment of uvea, conjunctiva, and cornea. मैं आज कल सुबह तक बना लूँगा. It will most probably be live from 3 to 5 the same time tomorrow. Okay? If you're not comfortable doing it tomorrow and you want to do it on Monday, so you can message in the group. जो majority कहेगी कि हम उसने हाथ से कर लिया. So that MCQ test will happen in the coming days as well. So does anyone have any questions? कुछ पूछना चाहते हैं आप लोग? So you're free to ask. Otherwise, we'll end with this session. ठीक है फिर अच्छी तरह से पढ़ लें एक बार कॉर्निया, because this is all which you need to know and remember. And if you give the read, it will become a lot easier for you. And if you still find any difficulty, कुछ नहीं समझ आ रहा, and if this thought process is not becoming clear, let me know. Either you can ask in the group, message कर दें, so I will try to answer it there. If it's too lengthy, we will discuss them in the start of our next session. Take care, everyone. Allah Hafiz.